You've likely seen the headlines. A tripledemic has taken over the country, impacting our kids with RSV, COVID, and the flu. Well, today, Health and Human Services Secretary Javier Becerra joined a roundtable discussion at Children's Hospital Colorado to look at the situation across the West and how families can stay safe. Denver 7's Megan Lopez spoke to one mom whose son nearly died from RSV.
We're very grateful to Secretary Javier Becerra for his attention to this issue today.
In an auditorium of medical experts in Aurora, a candid discussion about the severity of the so-called tripledemic in Colorado.
This respiratory season is very early and quite severe and is unlike anything we've ever seen before.
Doctors here dealing with an onslaught of pediatric patients for cases of flu, COVID, and RSV.
Things that we're used to seeing, but just at levels that we've never seen before.
The hospital says the number of patients coming in is 30% higher than the busiest day of a normal respiratory season. One doctor even saying staffing is becoming an issue.
We actually have our pediatricians are training adult physicians to help take care of pediatric patients in some of their hospitals to try and decrease some of that capacity.
Their pleas for help being heard by Health and Human Services Secretary Javier Becerra.
What do you need from us specifically? We're ready to go in so many different ways.
While they discuss steps forward, Yeva Alexanian is warning parents about the dangers of RSV. Her son ended up with a severe case 2 years ago and nearly died.
The night before, he was just fine, playing happily, and then suddenly on December 16, he started to show he started to have difficulty breathing.
They took him to a pediatrician, then the ER, where he was intubated for 23 days.
I remember us going, there is a little chapel in Children's Hospital, us going and praying and kneeling and crying about asking for help.
With some risky options, her son survived, but is still dealing with the health impacts to this day.
It is a lot of sacrifices, it's a lot of therapies, it's a lot of appointments with doctors because it actually affected his body.
So she's telling parents to be cautious this holiday season and not to hesitate to take their kid in if they're having trouble breathing.
Don't wait too long. Take them to their contact pediatrician's office.
Back in that Aurora auditorium, Secretary Becerra says he's still working on funding for the tripledemic.
We continue to request the money from Congress. We made the request again.
But HHS says it's ready to help states however it can as the hospitals work through the surge. Megan Lopez, Denver 7.
And let's take a look at the situation across the country, dig into the flu numbers that we're seeing right now. At least 45 states, including Washington, D.C. and Puerto Rico, are experiencing high levels of flu activity. There have already been 15 million flu infections nationwide. This is the earliest and most severe season in a decade, with hospitalizations climbing to 150,000. 9,300 people have died from the virus.
And here in Colorado, there's another illness going around impacting our children. Over the past few months, 2 Colorado children have died from invasive Group A strep. This infection is caused by bacteria getting into the bloodstream and other parts of the body. It can cause flesh-eating disease or toxic shock syndrome. Dr. Rachel Herlihy with the State Department of Health says children can get this infection after being sick with something else.
One of the scenarios that we've been seeing are children who have these preceding viral respiratory infections, COVID, RSV, flu, and then they start getting better and then they get sick again or develop new symptoms. And that's really when we start worrying about these invasive bacterial infections.
The symptoms of Group A strep include redness on the skin, ulcers, fever and chills, also low blood pressure and rapid breathing.
And let's provide you with some more context here. Some medical experts are saying this tripledemic shows that we need to prioritize paid sick leave here in the U.S. A study from the Public Welfare Foundation finds parents without sick leave are nearly twice as likely to send a sick child to school or to child care. According to the Bureau of Labor Statistics, about 1 in 5 workers in the U.S. does not have paid sick leave.